When you looked at this property the first time, what was your evaluation of what could be done with it?
No, I think the structure was in pretty good shape where you could go in and definitely put in a new hospital, and you're already ahead of the curve with the building already in place. There's a lot of renovation work you've got to do on the inside, but you don't have to start from the very beginning. So, you're basically starting maybe 6 months ahead. And with the way pricing is going now, structural steel has been going up like crazy and concrete. And so, you can definitely get things going a lot quicker. We were excited about being a part of the group and making something for the community to come.
Now, I know they make you keep up with all the costs and all the prices and everything. How much have you guys had to spend to get this thing in shape and remove the asbestos and bring it where you could start construction on it?
We're probably in excess of $1.5 million involved into this thing already, with the time and clearing out all the asbestos that we did, going through and testing, and there's still a lot more demo that's coming up. But we wanted to keep as much in place as we could when we stopped the last time so that we could try to maybe reuse it, existing walls and
that doesn't include the architectural cost of it, does it?
No.
How about how much you think the architecture cost in the
you could probably spend another $1 million or more just in the architectural cost, I would think.
All right, now we have a contract with you for $45 million to build it, but that was a couple of years ago when we did that contract. Have those prices gone up since then?
They have gone up since then.
What do you think it's
pricing
going to
has
cost
increased probably 10 to 20% since we started the project and then pulled off.
So what is that, around 55 or 60?
Yeah, somewhere around there. And it depends on what you do.
Okay, so all the other costs that we're going to have in the building are the cost of developing the medical group and the soft cost and the interest on the money and things like that, right?
Right. I think some of the facility has changed in what they were going to do. I think they've added a building on the west side of the property, that wasn't originally part of the plan.
Right.
The building on the east side of the property, we were going to renovate.
Right.
We had already demoed it, everything out of it, and we were ready to get started on that one as I guess maybe an MOB or something.
People that were here, the several other people that came and had this facility before we did it, they didn't have the capacity to build a hospital. And they thought that the only thing they could do is tear it down. But tearing it down costs more than the cost of the property, because next door, the property is 6 acres, almost as big as this, and it's $700,000. But tearing this facility down is a couple of $1 million. So nobody would buy it, which is why it's been vacant for the last 20 years. So we didn't think when we looked at it that it was possible to do anything with it, but to rebuild a hospital on it to make it right. What do you think about that?
I think it's a great idea, because I am familiar with one of my houses. I did a big renovation and saved me a lot of money, and it looked like new. And if you can make this hospital as good as we think it's going to be, there is no need to destroy it. Will be not only will make lose money to tear it down, but also the time and also the construction of this type. If they don't do it like it was before,
About how many primary care physicians were you relying on for the business that came to you?
The way the hospital system works in Dallas, and I think in all the United States, with the specialists that participate in those major hospitals, we have an emergency trauma call system that I distribute between all 4 hospitals. Each hospital has his one call system, but there is one that connects all the hospitals. And people like me that participate in all the major hospitals like Baylor, Medical Center Trauma Level 1, and Methodist Hospital Trauma Level 1 Medical Center as well, and also Humana Medical City and Presbyterian in Walnut Hills, Dallas. We were called for major emergency. According to the emergency level, the most traumatic and more difficult cases will be seen Baylor level level 1 trauma center and also Methodist trauma level center. At one time I was the chief of plastic surgery in Methodist Hospital, but 90% of my practice always has been reconstructive. I'm one of the few who can reimplant a hand or reimplant fingers. Baylor, Dr. Sarah and I was the only one for many years doing that in the whole Dallas area. And then all the people newer came out and started doing it as well. And I also, beside that, I did a craniofacial surgery for children with major deformity. I have a fellowship doing a Baylor Hospital and Children's Hospital. And in the Children's Hospital, we do many Down syndrome and Aper-Cruzon, all kinds of deformities, trichocoli. And all those were through either charity cases, because many insurance not covered out. Mostly people was poor, needed, that need to be done, and we just did it. Right. And the way that you mentioned, you asked the way that we counted for the primary care physician. Each hospital has a group of hospitalists that will see first all the patients that come to the hospital, referred to the hospital. And there's major group of clinic who refer to those major hospitals. They are aware of the need that the patient have, and according to the need, they refer to those hospitals. But what we mentioned before is that the majority of the need, about 85 to 90%, they are not as major as a trauma level 1 needed. I mean, the 10-15% still will be need to send to the trauma level 1 centers. But the others, 90%, is from the around here is going to come to this hospital if it's well equipped, like we plan to do, you know, with the top state-of-the-art in CT scan, 3D, and all the laboratory, Siemens, and all the other things they're looking for. Okay. And we're spending here, you are spending over $110 million just in renovation. But it's also going to be all the money invested also by other physicians who can come here. And we're trying to form a group, and I think we have formed already, of 40, 50 major specialists, more than 100 already. If you add the other people in the group, it's more than 200 doctors already that are involved in this. But the one that is participating directly here, all those are different specialty, from general surgery, cardiovascular, hand surgery, oral surgery, plastic surgery, gynecology, and a lot of internal medicines, and also hospitalists and primary care. That's what the hospital need. At the beginning, it's going to start in one way, but at the end, it's going to be bigger. This was also a major hospital before, with more than 128 beds, and we are going to start with a lesser amount of bed, but progressively, as the hospital develops, more bed will be added. But the main thing is that the people here that need the service is going to have this available very close to their house without needing to go to downtown to have the service done, except for the major cases, like I mentioned before, or major diseases that need to be treated over there. But I think that the booming of this area from the city of Dallas is going to be very, very important, because the people need this, and it has been in some way abandoned without any hospital this quality that is going to be closest to here. But now the city has rescued, or you have rescued this area, you know, bringing this hospital in this area. And I'm very glad of that. That after the hospital is built with all the new technique and instruments and the excellent doctors group that we are forming, that they are right now in Big Baylor, in Methodist, in Presbyterian, in Medical City, all these doctors also are coming here. And then with this technique available and all this new imaginary 3D CAT scan and all that, the people here in this area will not need to go to downtown for the majority of 90% of the procedure or the services that are needed for the health of these people. It will be about 10%, I suppose, that will need to be transferred, like always, to the trauma level 1 and those major medical centers. and we will be ready to do that when it's indicated. But the main thing is to try to help the people around here at much lower cost than we have it right now. The mechanism of payment is going to be by Dr. by Mr. Don McCormick, who has stated to me that he looked to help the poor and the needy people. That he's not here with this about the money. This started with the charity, and it's going to be a not-for-profit, and we're looking into that. And the city of Dallas is going to be, in big spot after that. If you can't now, right now, if a person get injury here, major injury or whatever, there is no hospital in the South except South Methodist Medical Center and Charlton's and Baylor downtown. And those are not in the real South. That's in the south of the city, but not in the south of the county. And then if you go north of Dallas, you see hundreds of hospitals or surgery center, everyone, because the north usually is where the money is, insurance are, but this is a needed community, and we're trying to help here the best we can. And I hope that everything that has been told to me is what is going to happen, because that's the reason that I get involved in this. And we know Mr. Don McCormick from Houston, or the hospital he has done over there, and he has helped other doctors over there, and he's a great person, and I hope that he accomplished what he wanted.